There's various impacts on a family. The family is the foundation to our community, and when someone's affected with a mental health concern within a family, it puts a hold on the entire family, and that's because they don't have an appropriate education at times, therefore they're stuck in trying to understand it as well. And sometimes they think it's their fault. So it kind of breaks down the family in that sense. However, through education, advocacy, and empowering families, they tend to build up that team support again. So it's just a matter of us professionals to tap into that and assist families, because there's a lot of coping strategies that already exist within families and they don't necessarily realize it.
As a family member of people living with mental health disability, you deal with a lot of emotions, and there's positive emotions and negative emotions, and you become really frustrated because you see that your family member is not dealing with their mental health disability, that you could step in and help them out. You can make life a lot easier. So it's frustrating, but you can't just take care of them. You can't just step in there and make them better. Sometimes there's a chemical imbalance, sometimes they need medication or they need professional help that we as family members are unable to give. We can support them, but it's frustrating because you kind of feel like your hands are tied and that you can support them, but you can't do too much more.
I was a kid who went from being very social to like a switch went off, and all of a sudden I was the opposite. I was a loner. It felt like a dark side of the world kind of opened up to me that I had not seen before. An ugliness in the world that I had not seen before. Just a part of, a negative experience of life that I had no idea even existed. And it kind of just, fell into my life like an avalanche, and I was completely overwhelmed by it and didn't know how to handle it, if I could handle it. And realistically, I didn't handle it at the time.
When the initial diagnosis was made, it was, the news is devastating. For any parent to be told that your child has an incurable illness is absolutely, it was just indescribably painful. So there's a period of I guess, just a sense of being shattered. That's the only way to describe it. And tremendous fear and anxiety, and a great deal of heartache on behalf of your child. We all want our children to be healthy and to have a bright future to look forward to, and to be presented with this diagnosis was probably the worst experience of my life.
And at first it was a slew of diagnoses, and they couldn't figure it out. Was it PTSD? Was it depression? Was it this or that? And then they kind of like funneled it down to a few of them, and he was on a ton of medication, and it was up to me and my mother to really, divvy out the medication, make sure he takes it, and, dealing with the side effects of medication, and, and the symptoms were still there. The behavior was still there. It took a long time to really fine-tune it. It took a huge toll on my family. The way I see things when situations like this happen, it can go two ways. It can either strengthen a family and bring them closer together, or it can tear it apart.
Sometimes when somebody actually gets a diagnosis, it's a relief for a family member, because they think, maybe now my loved one can get the care that they need. For others, there's a lot of denial, still trying to make excuses, maybe thinking, oh, it's my loved one is hanging around in the wrong crowd or using a lot of weed or whatever. For some, a lot of depression, anxiety about the future. And when we're thinking about early intervention, particularly in psychosis, there's a lot of hope for the recovery, but families already, they feel absolutely overwhelmed by this news and thinking about how am I going to proceed, how am I going to get through this, already thinking about what's going to happen when I'm no longer.
When we have initial contact with the family, there's a long journey. The first is that they find out that their family member has a mental health concern, and that puts a lot of stress on them because they're thinking, how can this happen to my family? Was it my fault? As parents, they assume that they did something wrong, but really they did not cause a mental health concern and they cannot control it. Here at FAME, we go by the 4 C's, which is I did not cause the mental illness, I cannot control the mental illness, I cannot cure the mental illness, but I can't cope with the mental illness. So during our first interaction with the family, we reiterate that, and we see the family really stressed out, and that really stands out to families. And through that process, as sessions go on or as more interaction takes place within FAME, we notice that family members start realizing that, wait a minute, it's not my fault, it's just something that happened, but I can cope with it and help my family member and myself. So you see that journey. I would say there's steps to each phase. So the first is shock, confusion, a sense of loss, and then you see families regain that strength again over time. At the end, I wouldn't say the stress is completely gone because there are different challenges that come in life, but everyone has challenges, right? It's just a matter of someone assisting them in recognizing that there are ways to get past those challenges.